about 15,000 a month. Okay, so it won't even last a month at NPP and Salt Lake. It won't even last a bloody month. But we have other sources of income that seem to be stable, so we'll be okay. But if our income was completely shut off and the government turns around, they give you $10,000, we are so toast. I mean, the thing is, because we'll be burning 5,000 a month, and you can only do that for so long.
So this is a good topic for Dr. Yu is joining us.
Hey, Dr. Yu doesn't have any overhead. He doesn't have any overhead, right? He's a doctorate. They don't have any overhead, right?
Oh my God.
You know? He doesn't have to make payroll or rent or have to buy equipment or do anything like that. No, it doesn't work. Of course they have it.
Just give me some chickens.
Welcome, Doctor.
Give me some chickens. I'll give you treatment. All right. Yeah.
Mm-hmm. Send me chickens. I'll send you chickens.
Yeah.
Like the other country doctors. Yeah.
Oh, Dr. Yu, we're going to have Dr. Bob Arnault, who used to be the NBC correspondent, medical correspondent for NBC News, on tomorrow. So he'll be our special guest. This way you can beam him with a lot of questions. We're also going to have Dr. David Moskowitz, who runs one of these weird, immunology. I don't know, some medical deal. Okay, I don't know what the guy does, but we'll find out tomorrow. So they're both going to be on tomorrow.
Well, yesterday I finally got around to applying for my payroll protection plan loan.
The PPP, baby. Yep.
And it took me literally all day to figure out the stupid application. And I bank with Chase. It's the biggest bank in the world. And
I got one of their cards here too. I got my Chase card.
It was so complex, and all I got was error messages, and I got all the information from my CPA, and finally, by the end of the day, I was able to kind of jimmy rig it to work. So yeah, they certainly don't make it easy, and
and there's an error in the application where the phone number is. It won't let you put the phone number, so it'll decline it and decline it and decline it over your phone number because
what happens is
it adds an extra digit.
A lot of business owners, they're just going to give up, because they make it so frustrating. I mean, and they don't answer the phone, of course.
Nope.
So,
there's too many calls. There's
275,000 yesterday.
One day.
My web geek, who does all my programming, he was denied. He has his own little business because he has a bad credit rating, and I'm like, who has a good credit score? I mean, if you're not above 640, you're toast. You're not going to get it, and I think
but that's not part of the policy either.
Not part of the policy.
I think now we're not talking about the credit score, we're talking about the good antibodies. So who has the good antibodies? That should be the question.
Yeah, as far as I know, I heard your credit score has to be at least 640. Right?
That's not
the policy.
See, we're going to do a follow-up.
It shouldn't be. That's going to put a lot of businesses out of business. But here's the deal. Right. Even if you do get 2 months of operating expenses, that's not going to save you because even if you get this loan and your business is still on lockdown, I mean, your employees are going to be sitting around doing nothing. The whole point is to open up your business to get production going, and with the 2 months of operating expenses, you could continue. So after that dries up, if you don't have any business income, that loan is for nothing, So
but the Payment Protection Payment Protection Program is actually 8 weeks of payroll that they're going to pick up for you. So that is actually a pretty good program.
Yeah, but my point is, what happens after that 8 weeks? If you have no business income? See, it should be like a 6 months loan.
That's what I'm saying. The thing is, we don't know how long this horizon is going to be.
Exactly. Yeah.
If horizon gets that long, businesses are going to be out of business. So we had
like for us. I went back to the clinic Tuesday. We opened up after 3 weeks of shutdown, And majority of patients are afraid to come in.
Of course.
So even if you do open, you know, if you don't have any business, after 2 months, what are you going to do? That 2 months loan is not enough. It should be 6 months.
Yeah,
you know?
I mean, because I mean that is the realistic time frame. Because the thing is, you know, we're looking at probably January of next year. Although there are a lot of developments and treatments and vaccines that are out there. There's now over 100 of them that are floating through the system. But still, you know, the businesses have to survive till probably January of next year. However, here's what the senators have said, and it may happen as early as this week, because remember, Dr. Yu, this is the first time I've seen where Congress passed a bill that allows small business and individuals to get anything. Usually they give nothing to the small businesses, or they give you little trinkets. Okay, here's your little trinket, out the door you go.
Yeah, they throw you a bone once in a while. You know?
There's no question. They throw a bone. And then the large companies, I got back here in the TARP Act. $700 billion went to large companies. You know what happened to small individuals? Well, we'll give you 15 cents, or you get $1. I mean, they give you nothing. A $250 rebate, they gave you nothing. And that's typical what happens here, as you know. This is the first time I've seen where they're open the spigot for small businesses and individuals. First time I've ever seen it. Okay,
but I haven't met one business owner
I haven't either.
who got a penny. And you know that $10,000 emergency disaster relief fund? I don't know anybody who got that either.
I don't either.
So
wait. Can I share screen here, Kim?
Yes,
I'm going to show you guys something in just a minute.
So go ahead.
It'll be a minute. I just got to get
conversation to share. So go ahead.
Right. Yeah, I see. Not that I
gave this class yesterday. Nick gave this class.
I know, and of course we got.
And we actually piped the class into our show yesterday, and Max was very, dead on. He said, "Give it 8 days," but there are a lot of people getting denied for what you're talking about. But the policy did not say you had to have a good credit score. It did not say that you had to have 10 employees or that you only get $1,000 per employee. But all of these banks are making up these rules, or these senators are making up these new rules that did not exist in the original stimulus bill, which was 890 pages, which I read some of them, and Nick and his team have read them. So these policies don't exist. So we're going to have to come back and fight them. We're going to have to fight them. But you're right. It's only going to make the matter worse because it's only going to keep you for a month. The $10,000 would only pay my employees 1 week. Nick.
Well, if your business is already in trouble because you've been inoperable for 2 weeks, there's more systemic errors. There's more things you have to do with your business. It's kind of like a wake-up call. Oh, you really should have 6 months to 1 year of operating expensive emergency funds. And if you've been operating your business paycheck to paycheck, we got 6 months of operating expenses. We're good, but average business owner, they've never learned that. Even your personal expenses, Dave Ramsey teaches you need 6 months of a rainy day fund. And most Americans don't. They live paycheck to pay. It's a wake-up call. You better not overspend. Live within your means in your business and your personal expenses. So I think there's a good thing about this. It's making Americans saying, hey, we're the land of, use your credit card, of getting in debt, buy whatever you want. No, you got to put money, 10% of your income in a rainy day fund for your business and your personal expenses. And that's what we should be working on now.
Money and you're getting loans. They want to know that you've allocated that money not to your savings, but that you've allocated that money.
Exactly. You have to use it on payroll, utilities, rent, and business mortgage. And you have to document it. And if you do, supposedly it's a forgivable loan, which means it's like a grant. You don't have to pay it back. But you need to have bulletproof documentation that you're using it for those 3 expenses. So you really have to work with your CPA And
Or
the businesses
be-
that don't have good record keeping, oh, this is
Yeah.
going to call them out. So yeah.
So this is the big issue right now, and I'm glad that you're bringing up some of the concerns of the small businesses because like Nick and I said, this was the first stimulus ever designed to go bottom up. That they actually wrote in the stimulus for small businesses. Uber, the CEO or CTO, maybe it's the CFO of Uber, called the president's office and said, "Hey, while you're doing this stimulus bill, think about the what we call gig workers, the drivers of Uber. They need money too because they're not driving like they normally would." So they literally set aside money just specifically for Uber drivers as well as gig people, but they did. So
yeah, there's a separate for independent contractors, 1099 employees, workers. They could apply starting April 10th for some type of payroll protection for that category. But that doesn't help me or the business owner who gives work to 1099 workers because I can't claim them on the payroll protection.
No.
So it's a catch-22.
It is, but maybe it's meant to really give you money to put back into circulation because they want you to spend it. So when you get it, you're told to spend it, not save it, not sit on it. You are told to pay your payroll, pay your rent, like you said. So it's truly about just getting money back into circulation. This is not about sustaining you, really. It's not. Like you said, the amount that they give you doesn't hold you over. Most of it's, for a business like yours or Nick's or even one of mine, it's only going to keep it 1 week and that's it.
Yeah.
You're done.
And that's why I'm offering some consulting where I coach other type of doctors or healthcare professionals how to get out of like an insurance-based practice, which is overworked and underpaid. Because it's like pulling teeth getting reimbursement from insurance companies, Medicare, PPOs, HMOs, private insurance. And I teach them how to make a low-stress, profitable concierge practice based on cash for fee service. That way the doctor gets paid what they're worth. They can deliver high-quality care. They're not spending their time fighting insurance. The patient's care is not limited to what their policy covers, and it's a win-win situation for everybody. But yeah, I mean, if you're a doctor and you want to learn how to, do a practice right, then, I can help them do that. Yeah.
I had several doctors leave the Duke practices because, it's all insurance-based to go open their own private practices, just like what you're talking about. One of my conversations with them, I'm such a geek when it comes to certain things. Instead of asking the doctor, will I live tomorrow? I go, how much, because of all this insurance, how much do you really get? Because most of the time my insurance company's denying payment for my treatments and, but how much do you actually get? And one of my doctors told me that he only got $10 per every visit. That's it.
If that, yeah.
Like, oh my gosh. And then you got to put that towards your business. You got to pay your nurses, your admin. And he told me that he actually lost money because of the insurance companies and that the insurance companies, he fights them as well to get money for everything.
And they change the codes every year.
Yeah.
And it's like a puzzle. It's a game. You got to learn the coding. You outsource it to a billing company. They take 7%. And there's just and after Uncle Sam takes his 40%, you have nothing left at the end of the day.
And then you work
to do that for you. You have to hire extra admin.
The real stimulus payroll protection. Here's what they should do: state or federal income tax for this year, and that's like a 40% increase in your income. Just by not paying your taxes.
I agree.
And then they don't have to write you a check. You're just not writing them a check. You already have your disaster relief right there. Yeah.
I agree with that. And I brought that up yesterday. I agree. No taxes for the year. And then the big companies could survive.
Well, the airline industry, they're being bailed out.
The airline.
I don't think it's.
I just agree.
Yeah.
Just to go.
All these big companies are going to be bailed. The banks are going to be bailed out.
Where's my truck?
They deserve to go out of business and start over. They should, you know.
Insurance needs to go out of business and start over. Health insurance sucks. The whole system is bad. Excuse my language, but you know, and Nick, I think wanted to share a page with you about our class that we had yesterday to show some of the things that people need to be aware of. But you know, this is what Dr. Yu, what I was talking about before you came on is, you know, we've been having this talk about all of this, and I feel sorry for our friends from other countries. They don't have this problem. They're all happy and thinking about their work. They're not worried about whether they're going to sustain tomorrow because their government is taking care of them. In Australia, they've already received 3 stimuluses. There's no written anything, just, you know, here's something to help you get by. You know, some of them it's not helping a lot, but it's something is better than nothing. And there's no underlying written, everybody gets it. And, you know,
so
same thing.
So what I've done, Lee, navigated the payroll protection program as a medical healthcare provider. If you're in that industry, you can go to my website and I can help you navigate that progress, and I can help clinics convert from insurance to a concierge cash model. But the website is www.theconciergeclinic.com.
Can you spell that out?
Yeah, it's complex. So www.the concierge CONCIERGE clinic.com, and then you can apply for, I could give you some free consulting on that. So I want to help other doctors survive this, you know, this COVID pandemic situation, because the more doctors there, the more Americans get more healthy, boost their immune system, we can get out of this. So,
well, and the thing is people don't understand that doctors don't get paid very well anymore under the current insurance plan. And personally, I'd rather have a happy, well-paid doctor than a happy, well-paid insurance man. So,
well, think about it. Even if network or hospital or group, look, we talked about this. It's managed by some MBA. He's not studied healthcare medicine at all. Hasn't touched the patient, calling the shots. Most hospital executives get bonuses out of poor patient healthcare outcomes because that keeps in the hospital longer. It's more profitable. It's sad. So we should have the doctors actually be the CEOs of these healthcare companies and hospitals, because they know what the patients go through and what the doctors go through.
Well, I think
there should be a reset. Yeah. Look, we've proven our healthcare system it's incompetent. It's not ready to handle these disasters. Yeah. It's a failed medical system.
I mean, I look at it, they're not worried about whether they can pay their medical bill.
Well, see, Dr. Yu, see, here's what got me. The minute this crisis came down, who was handling it for the United States? Politicians. They're really in a position to understand.
I'm sorry, but Fauci is not a real doctor. I don't know if he's ever seen a real patient, you know, because look how he's handling it. Just last week, he's saying, "Oh, now I think you should wear a mask." It's like, that should have been from day one. I mean, come on, you know.
I totally.
And now it's like, oh, we don't have any effective testing kit methods. Are you kidding me? You're the CDC, 20,000 employees. What have you guys been doing?
What have you guys been doing all this time?
They got to watch the movie Outbreak with Dustin Hoffman. I mean, come on.
I watched that the first day of this outbreak.
Did they ever listen to Bill Gates' video 5 years ago? I mean, he put a whole video, and Bill Gates does not have a medical background whatsoever, but he's not a stupid guy either. And so he puts together this whole
video. He did a whole simulation.
I know that.
Like 2 months ago.
Yeah.
And it was a conference, and they did a mock situation. What would happen if we had a pandemic with a coronavirus? And they didn't listen. So yeah.
They don't listen. Bill Gates.
They,
No,
they
Bill
didn't
Gates.
pay attention to that, did they? Not a bit.
We totally ignored this guy.
Why
Now,
have the research and why have those emergency doctors? And here's my question: we had apparently a pandemic emergency team that we fired. Where are they now? Why don't we rehire them? Where
was
are they?
disbanded in 2018. So the thing is, this whole thing was like shelved in 2018. It was ignored, and again, there's a like what you said. When the minute I saw, well, who's running this operation, and I wanted to see a board of directors of people that were pathologists, immunologists, internists on the board sitting with the president. Okay. Instead, I saw, I hate to say it, Mike Pence. Okay. I'm going, oh, that's.
I got something to add here.
They gotta hire Dustin Hoffman. They might as well hire Dustin Hoffman to put the hazmat suit on and have him say it's airborne, which it is.
So I'm going to bring up two current things. One, I heard that Giuliani was appointed the science advisor to Trump's staff. I don't know how true that is. He has no background in that, but he did invest $2 million in the Novartis stock in February.
So there's a conflict.
And Novartis, we know, they invest in a lot of, guess what?
Yeah.
Cellular therapies, like stem cell therapies for cancer called CAR T.
Yeah. Well,
and now this vaccine for COVID. Right. But you don't hear this about them in the media. You don't hear that there's a company called Singularity. They got rapid approval for stem cell,
but see, the thing
natural
is,
killer cell therapy for COVID, but you don't hear about that.
Yeah, but Doctor, you're not going to hear that from the mainstream media for this reason. In 2 minutes, we've got to run our pharmaceutical commercial from
basically.
In other words,
we can talk about it here all day long.
We can talk about it here all day long because we're not backed by the pharmaceutical industry. But here's the realities of the situation. If you go to any of the major news channels tonight and you listen to them, half the ads are from the pharmaceutical industry. I'm not kidding.
Well, guess what? Who do you think owns the media?
It's the
Big Pharma. They spend.
Kim, we need to get the pharmaceutical industry on our show so that we can.
No, because then they control what you can say. And
they spend 2/3 of their budget on marketing.
I think
TV commercials, magazine ads, newspaper ads.
And I'll take the money.
They hire ghostwriters. Yeah. That's the best medicine there is. Stay home.
That's our advertisement. That's advertisement.
That's a IBM from IBM Pharmacies, right?
Yeah,
right.
IBM. I believe in medicine.
There you go. I believe in medicine.
Well, when Kim and I were in our board, we were discussing this. I said, look, if we're going to put together a show on coronavirus, we need to invite doctors on the show because they know something about this. Instead, if you look at a lot of the media that discuss this, it's what I call the talking heads. They talk about it all the time.
Well, they frenzy feed off of negative news. I know that's how they make their money.
Well, if it doesn't bleed, it doesn't lead.
And they suck people in like a soap opera. Oh, I got to see the next thing. And they'll say, oh, 2/3 of Americans, they're going to get the virus. And the next week it happened, they want to suck you in with their negative media.
See, I missed the immunology classes and the pathology classes. I missed all those classes when I was in college because I became a lawyer and they don't have any of those classes in law school. So the thing is, I'm going it'd be nice to have
you didn't miss out on too much because in medical school, there's maybe one class on nutrition. So
really,
and medical school is designed to be. You got to be a specialist, right?
Sure.
You got the heart doctor. You got the brain doctor.
Cardiologist.
Yeah, you got the gastroenterologist.
Yep, all the specialists.
And so you only learn your specialty. So you don't learn how to get the body working together systemically as a whole. So you're really learning to treat patients in a sick state. So it's not healthcare in the U.S. It's sick care. All right. Mm-hmm. And they don't learn how to get the body's immune system working all right, through nutrition, balancing your hormones, natural therapies. I visited a patient a few months ago who had a stroke, and I recommended, you should take these vitamins. The nurse said, that's not allowed. You cannot give vitamins to a patient in the hospital. But if it was a drug prescribed by your primary care, yes, you can.
Yeah, drugs you can. Right.
And then we're finding out, the president and senators are all invested in these pharmaceutical companies. So of course they're going to.
The conflict of interest is amazing.
Right. Of course they're going to make the laws that we can't do certain things because they write the laws, and so it benefits their pocket.
Yeah, I'm just wondering, why it appears to me that the American medical system doesn't seem to be interested in what's happening in other parts of the world.
You mean there's a world outside America? Is that what you're trying to explain?
That's what I'm trying to explain.
Oh gosh! Well,
yeah.
Okay.
That's exactly what I'm trying to explain.
You got to come over here and understand this place. Okay.
I've been to America. I've worked with an American company, so
we don't know.
After me, then comes America.
We didn't know that if you have half the Americans, ask them, can you please show me India on a map? And you gave them this big thing called a globe, right? Half of them would be stumbling around. India, where's that? Oh, here it is. I think it's down here. Right here. Here it is. Right down here. Is this India? It's pretty big. Oh no, that's Brazil. I'm sorry. I mean,
what happens to all immigrants from India? I mean, I heard Dr. Yu talking about systems that don't work, but it looks like you need more H-1Bs.
Well, the thing is, we have a lot of systems that are disparate. They don't work, and they're based on the Adam Smith invisible hand, okay? But see, the invisible hand met the invisible virus, and the invisible virus is right now eating up the invisible hand, and that's the realities of what's going on here, because the thing is, we had nothing. We completely disbanded our how are we going to handle a pandemic. Bill Gates came out with a blueprint. He goes, I've read everything because he has nothing better to do. He made his 100 billion.
Hey, I have a question. In India, what do people think about Bill Gates? What's their opinion of him?
Yeah, good question.
I haven't been in India for a long time, but maybe Ankit can answer.
Yeah. So Bill Gates, I think Bill Gates is one of the, richest person in the world, and he's very brainy, and he's built a Microsoft, so he has a lot of things to take care in terms of the philanthropy work. What is he doing? And people regard Bill Gates as a very gentle and kind human being.
Yeah, really? Because he donated a lot of vaccines to a lot of the children, like the polio vaccine.
In India too, yeah.
The problem is a lot of the kids got adverse reactions. Like some kids died and didn't have good reaction to the vaccines, and I think a lot of Indians complained about that. Do they really need a vaccine, for polio, which really has been eradicated years ago? I'm just concerned that if these vaccines are rolled out, because he's one of the biggest funders of the World Health Organization, but I'm concerned there might be a conflict of interest because he's so invested in the vaccine industry. We don't want him to roll out a vaccine for the supposed COVID virus that does more harm than good. That's my only concern about conflict of interest, So
he's actually done a lot of work for women in the red light district. He's one of the pioneers. Bill Gates has done a lot of work for women in the red light district, prostitutes in India. Even the government of India has sort of washed the hands of this class of people. So he's done a lot. Bill and Melinda Gates have done a lot of work both in Calcutta, Mumbai, and Delhi, where there are, close to about 400,000 women who are just completely ignored by the government. And that's just one of the projects that he's involved in. So he's respected very much, I think, in India. Though I've been out of India for about maybe 20 odd years, but I have family there who have a lot of respect for him.
Yeah, so that's an example of how Americans are helping other countries but it's not like the government is, right? It's private industry, and it's private industry is what's going to get us out of this mess. You know, business owners helping each other, just like this podcast. Hey, you know, we're here to give unbiased information to business owners, healthcare workers, right? How to survive this coronavirus by increasing your immune system, how to financially protect yourself. So that's the bottom line is, you know, people who don't have ulterior motives, you know, to sell, you know, drugs or a vaccine to help people out of their own heart and not because there's a conflict of interest. You know, just like Kim was saying, in the government, there's too many politicians who are on a board of directors of big pharma. Like even these FDA agents, when they leave the FDA, who hires them? Big pharma, because they have all the inside connections.
That's the same thing in the finance industry. It's the same
exactly.
thing. All the guys responsible for the 2008 crisis, all hired by Barack Obama. You know, so
it's crazy. Yeah,
that's normal. It appears in America. It just
that is normal.
That's
normal. Interlocking corporate directors is normal. This way. Hey, come
corporate
on.
criminals.
No. This way,
they're white collar criminals. Yeah.
Yeah.
This way you
keep legal, right?
Hey, listen. This way you keep the money in the family. You keep the money in the 1% family. Okay, so that's the reason you do it.
Yeah, you keep it in the Bilderberg family. You know, the birds. Yeah,
exactly. So the thing is, there's absolutely a reason for that. And I'll tell you, they did a study on mobility in the United States. Mobility here is very limited now. In other words, if you are born in one class in the U.S., you stay in that class. You can't move up. You don't move down. You stay in it.
That's just like India. India, they have a class system.
Well, we do too.
And that's why the wealth gap.
Yeah, it's huge.
Really like that. There's no middle class anymore, even in the U.S.
We don't have a democracy where we can change our stars, like in The Knight's Tale.
The thing is, as we well know, in studies,
I'll never be a princess.
Okay, half.
You have what was that called? The electoral college that sort of just negates everybody's votes and.
Right,
you know,
but Rakesh, half of our assets are owned by 1% of the population. So if you went into a room with 100 people, okay, you've got to find that one person in that room, and he owns more than almost everybody in that room combined. Seriously,
and that's the case in most democracies.
Yeah, it is.
That's the case in most democracies.
It is, okay. But here's the other reality. Half the people in the United States have no financial assets whatsoever. They have a zero net worth. So if you have 100 people in the room, half of them have nothing, zero. And in the last act that was passed by Congress, and here it is, the TARP Act, $700 billion bailout, okay? Because I remember this took place in 2008. I did lectures on this because I'm not like Dr. You. You can talk to him for free. You call me, you talk to me. As an attorney, I will send you a bill, okay? And it's not going to be a small bill. That's my two favorite things. $700 billion bailout. Well, guess who got the $700 billion? Large companies and large financial institutions like AIG. Who didn't get it? Everybody else out here, they didn't get jack. Basically, they give you a little trinket and say, "Oh, we're giving you a $250 rebate." In the meantime, they give AIG, $25 billion. Seriously, that's what happens usually here all the time. This was the first act I've ever seen where they're actually handing money out to just regular Joe.
Wait a minute, they wrote the bill, but as we've heard from Dr. Yu and maybe some other people, maybe it was just to look good. And they put all these little provisions.
Listen, they're kind of stuck with this because remember, we did a lecture yesterday on it. We're doing another one on the 22nd. Okay, and the SBA is trying to change the rules in the middle of the ball game. Okay, they're going to get such backlash from the small business owners because here's the realities also. Half of our population in the United States work for small businesses. Okay, as a united force, they're bigger than the big companies. That's the realities of it. they made their first offering to small businesses to help them. And now the SBA is trying to change the rules in the middle ballpark. Well, we're not going to give the money out in 3 days. And I'm trying to post the senator letter, but because some of the senators are upset with how the SBA is administering this, and not 3 days, maybe 7 to 10. Oh, we're going to deny this claim because of X. Okay. And they may not be able to do that legally. And this is where you need lawyers, okay? Because we have this thing called class action suits. Because if one person came to me and said, the SBA isn't following the letter of the law, I go, well, I'll sue them. How much are we going to collect? $10,000. Wait a minute, that's my legal bill. Okay, so the thing is, you have to bring a whole class together and file a class action suit.
They don't know, but when you fill out that form, if you notice, it has a little provision there that if somebody helped you fill it out and how much do you pay them, you have to say who they are and how much you paid them. Well, Nick's bill is $10,000 to fill out.
No, I could not do that. They actually have a form. And
anyways, y'all, I got another podcast. I'll see y'all tomorrow then, okay?
Okay, yeah, we'll see you tomorrow, Dr. Yu.
Bye-bye.